this meeting to order. Law Enforcement, Public Safety, Health and Welfare Committee meeting. It's October the 10th, 7:07 p.m. First on the agenda is the approval of the July 7th, 2017 minutes. Do I get a motion to approve?
Make motion.
All in favor? Aye. All right, on the discussion items, we're going to postpone three of the items up here, which are update on law enforcement, cleanup efforts, discussion regarding lithium battery safety, and discussion regarding dumping limbs and brush into city landfill, and move to the matter of discussion of EMS expansion in the county. And I will refer to the Rescue and Fire Commission, if I may.
Okay, yeah, thank you, Mr. Chair. I'll go ahead and start the discussion off. We were contacted a short time ago about from a community about a lack of EMS coverage in that particular area of the county, and wanting to see an improved coverage and response time in that area. We met with members of county council as well as members of that community on one or two occasions, and it really sparked a discussion surrounding more of just a particular area, but how do we address coverage holes for EMS services countywide. Just for a point of information, the county does not provide emergency medical service. The ambulances that you see are obviously provided by the Greenville Health System at this point in time. What we do provide is we have a dedicated team of volunteers that operate our rescue squads throughout the county that provide excellent medical care at the same time as the ambulances. We also have paid staff who are all trained and certified in different levels of emergency medical technicians and paramedics. So between the hospital, our rescue squads, many of which have EMTs and paramedic certifications as well, and our paid staff, we've got a pretty big team of medical response. One of the things we would like to discuss and see plan going forward in the future is how do we expand EMS service and get more direct medical care to the entire region of the county. This particular community had some concerns, and rightfully so, when we look at some of the call volume statistics, that it takes so long for an ambulance and even really a first responder to get to that particular community. So we went and met with the hospital to talk to them about EMS care and talk to them about the availability and direct access of that ambulance service. And we had a number of discussions. We actually had medical control in there as well, which is the doctors who are basically in charge of and certify the medical care given to patients as part of that ambulance service. So we had medical control doctors there. We had the hospital's director there, as well as the director of their EMS services. I don't know what his official title is, but he runs the ambulances. And we had a great discussion about a number of different options, anywhere from quick response vehicles, which we call QRVs. QRV, if you're not aware, is a single vehicle. Sometimes it's a truck with a cab, sometimes it's an expedition, but it's basically a one-person staffed, whether it be a paramedic or an EMT, staffed vehicle that has all the same equipment that an ambulance does. The only disqualifier from being an ambulance is that it does not transport, and it only has one particular responder on it. But what it's intended to do is be able to remotely place these QRVs out in some of the regions that have quicker access and can get there and begin care while they wait on an ambulance. We're running anywhere from 3 to 4 ambulances a shift. Is that correct? 4 to 5. 4 to 5 ambulances on a shift, if you will, in the county. And it's a pretty big county with a fairly large population. So trying to handle all the calls that we get in can be very difficult depending on the time of day and the current events that we have. So rather than trying to resolve a particular area's issue, we have as we spoke to the hospital and I've talked with our responders and our medical folks, we really would like to kind of look at the overall improvement plans that we need to be working towards to improve medical access countywide. So what I think our request is, and I'll give Chief an opportunity to clean it up here in just a minute, our request is that we actually create a committee to help study the improvement of medical care. And this is not just a committee of county folks. We're actually incorporating communication. We're incorporating the hospital the doctors of the hospital. So we'd like to have fire, rescue, dispatch, medical control, and EMS represented on this committee. There's been some discussion about maybe integrating communications some to help clean that up, streamline that, as well as also having doctors involved that want to discuss QRVs. That was something that they were very interested in. We ran those at one of the counties I worked with previously. Much less expensive to staff and equip, and actually has a much better response time. So we positioned those out. So I've got some experience with those, but they really are interested in discussing the QRVs. So I think one of the discussions we want to have is not only to let the community know that called us, we are working toward a plan. We are still working with the hospital on that particular issue, but in a bigger picture, we'd like to see the committee be appointed so we can start working on those. And Chief, I'll let you clean it up.
So the QRV person would be a county employee, or it could be either
It could be
or?
the hospital, it could be a county employee. I mean, we don't know that yet, and that's why we want to bring all these people together. And I think that's why the doctor wanted to have those discussions as part of a group, so that the hospital and the county can kind of discuss how we could do that. But
I think all of that's absolutely correct, and I think we by all accounts, absolutely support any growth in our medical delivery system across the county. So don't want it misconstrued that we're wanting to put a halt to put more ambulances out. That's the opposite. But what we want to do is make sure that those efforts are focused, that it's a team effort across the board. And before we kind of go to, especially make investments in it, that we've ensured that the system that we have today has a solid foundation. Mr. Mulder mentioned that the hospital provides EMS. We consider the county delivers it as well. We have a DHEC license. We have both incredible volunteers and career staff that respond and provide basic life support services, and have shown the value in that. So we want to make sure that both of those organizations are working together. They've both shown some pretty exponential growth over the past couple of years. And that growth may not have been completely together. So we want to make sure that communication is stronger and more seamless than it is right now. And then to consider both call volume, response times, ambulance locations, current staffing levels in that plan as we move forward. And like I said, the QRV is one discussion. More ambulances is another discussion. I think bringing those 5 stakeholders he identified to the table and us putting a plan together for discussion by this group in the future is the absolute right way to go. I will tell you, we've shown in the last week what placing trained responders out in the community can do. The Holly Springs area typically is unmanned, unstaffed. The closest ambulance is typically Westminster or Seneca. Last week, one of the 6 new employees you approved in your budget was at that station. There was a cardiac arrest 3 houses down. They had a 92-second response time where that typically would have been about 14 minutes. So there is some benefit to the investment and having a plan in place in that, as demonstrated in the plan that was executed over the last year and you folks put into position. So I think that's the request, is the opportunity to gather the stakeholders, to first look and make sure what we're doing today is seamless and integrated and working towards a common goal. And again, the growth is exponential. Our medical responders are turning nearly 7,000 calls a year, which is just incredible for a county this size. So I think it's understood that growth is needed, additional resources are needed. It's just making sure that we got the plan to support it in the background.
So currently, right now, we have in place Walhalla. Is it just one?
One ambulance in Walhalla
Westminster?
and 3 in Seneca.
3 in Seneca, which is all on GHS grounds, right?
That's correct. And
Okay.
he mentioned the QRV. Technically, the county staff is staffing 2 QRVs now. We have 2 of our units that are DHEC approved and are answering calls at the BLS level, and that having those 2 certified gives Steve's a good example, a volunteer that's trained and carries certifications to operate at that level as well. So I mean, there are a lot of options. I think with the strength of the 2 organizations working together, there's a lot of potential there in the future.
Well, I think just in review of a lot of the training that's going on from a voluntary perspective, as well as you know, our county staff is quite amazing, what they continue to accomplish on here. And when you talk about, you know, you hope you never have a catastrophe in a county, we're, you know, continuing to do everything we can to be ready. And I think putting, I mean, there's stories after stories about having, you know, first responder that's at least trained in, like you said, basic life support, is a life or death situation. And, you know, you can't value a life, especially in these cases on there. And so anything we can do to, you know, continue to improve those locations is great. And I think, like I said, from, you know, firefighters don't just fight fires, they fight for a person's life too. And I think that's a great thing moving forward on there. So I appreciate all of those, the paid and the volunteers. I mean, it's just you know, amazing county when it comes down to that stuff. So, so I guess, you know, in proceeding with something like this, we would just continue with those discussions moving forward.
Yeah, I mean, I think we are trying to gauge your support on whether or not you would support us putting together this committee, and maybe even direct us to bring back a medical services improvement plan. I don't know if that's what we want to call it, but some type of medical services improvement plan to review for how we can improve the future.
Yeah, I would support that 100%.
Me too.
Okay.
Do we want to have it as a committee, an ad hoc committee of the council? So we'll do it up a little more formally, similar to the resolution we did for the Recreation Task Force? Or do y'all just want to have it be a motion right now, a committee for the law enforcement, public safety?
I think you could just allow it under the same scenario.
I would be fine with them just asking us to bring back a plan, then we can create the committee administratively with who we need on to create the plan. I don't know if with the participants, I don't know if they need a role in appointing who they are, so
Yeah.
they would just ask us to bring back a plan. We can administratively create the body to help bring the plan back, unless you see the.
Due to the fact I think we have employees that's their position. That was the hardest thing on the recreational side of things. We didn't have necessarily a person that was over, you know, county recreation or something like that, which is the reason for a committee such as that. So I don't personally feel the need for another. So I don't know another council member that wants to add another committee to their. So I know several of us would want to be involved in that, in those discussions. So. Okay. Anything else you have?
No.
Get
You're gonna need a motion to authorize you to go ahead and do that.
Just motion to direct staff to submit in the future a medical services improvement plan.
Make a motion.
all in favor?
Aye.
Aye. All right. Any other business?
Yes, sir.
Motion to adjourn?
Motion to adjourn.
All in favor? Aye.